Dog is okay. These are all members. 老叫来叫，别整你这就动你动，你这就动你动啊。
It's good lah.
Oh, this one is good. This one we are here.
Nó có con thì tao ăn good là good.
I will.
Nhà cái bài nghĩ là nó đau mua nè, nó đau.
好，就把你了。
Ini kan boleh.
15 is TCM David go again, huh? 15 is yesterday yesterday over. Next week, 这10個是今年是16號嘛？
這啲水嘢，這啲水嘢。
Kita tahu ah, kita.
這是 this week 啦。
Which one I should be using? There are 3 remotes here.
No, this
This
one.
one. This is the.
Is this on?
Yeah, that one is the remote for
The screen very nice lah, screen very colourful.
That's the pointer. That one is the remote for the pointer.
Có screen này rồi, muốn nào à? The screen very clear.
It's not moving.
Lighting like this. Có to engineer.
Yeah. Check it out.
It should be connected to one of this.
This
This one, no light. Có chỉ cái light này.
No light is either the switch.
Okay. Nó cứ lại khỏi. So, thực ra là
Nghe nghe, có câu cho bộ vấn chế họ được khoa đấy, tuy về tuy nào, ok? Ta bay ra đi khoa, mình có thể bay nè, chính xác tuy bay cào lào, mà chơi gì đó.
được.
Yeah, ta tuy đi bay một đỉnh nào đó.
Okay, this time the breakdown ah.
Breakdown, tuy bay rồi đi. Last time was 2 3
Can work, sometimes can work, sometimes cannot work.
Yeah, sometimes can
Chemical fault lah.
So this mechanical fault, yeah, mechanical fault. No?
Okay.
Definitely is the equipment fault.
Oh, like that. Oh. Over, new over.
Power already. I don't know what happened.
1 or 3.
Oh, this is cái funny này, electronic này đây. Electrical.
Bộ em, okay.
Cái gì chỉ nó thì gọi. Ôi, Apple này, anywhere cũng này, đúng không?
Okay, so so today's my talk is more in reference to the central nervous system.
Wow. New one new topic ah.
Very good. Thank you.
Every time new topic.
Wow, I like that. I like that. But you don't do the same thing one ah. Some speaker I don't repeat the same one.
This is
New one. Last time never talk about.
Okay. Otherwise, I'm not a medical doctor if I can only sing one song.
right.
I can sing many songs.
That's the truth.
So today's song is on the central nervous system.
This one is a new song.
I hope you all will learn something.
Yeah.
So this quotation from Hippocrates talks about heat, and certainly heat is a very therapeutic medium whereby we can use to cure. Physiotherapists make use of it a lot, and a lot of treatment in inpatient service make use of heat. And at home you use hot and cold compressors. That's heat as well. And of course Albert Einstein's quote is about frequencies. And this of course has been widely researched. A lot of frequencies have been used. Basically the reason is because our body are made up of cells and biological components that resonate to certain frequencies. So terahertz, as you know, is technology that is in many areas: health, science, military, agriculture, communications, and I have shared before that in telecommunications 5G is terahertz waves, and recently they have tested 6G.
Terahertz doesn't need terahertz.
They have tested the safety of 6G terahertz waves on human beings, because you know that at one time handphones was associated with cancer if you could use it to make phone calls. So it was found to be very safe. And recently there was a breakthrough in finding out devices that can detect terahertz wave. And so the person who wrote the article say that this herald a new beginning in the application of terahertz waves to medical science. And so that's where we are. So, as you can see, this is the visible light from 700 nanomoles to 390 nanomoles or 770 Hz to 430 Hz. Okay? This is visible light. Along this side are ultraviolet X-rays and everything. Along that side you have infrared and microwave and radio waves. Terahertz is right in between microwaves and infrared waves. And that tells you something. Because it's in between, it shares some of the features of microwave and it also shares some of the features of infrared. And we know that infrared has been very useful for health. We know that. My old friend has bought an infrared mattress for use for more than 10 over years. And that's supposed to have health benefits. So this is not unknown. I want to share with you this because terahertz is not something out of the known and suddenly you have this thing and people say, is it real or bluff? It is real because we know that this kind of waves have this kind of benefit. And if we say terahertz waves can penetrate, it shares this property with microwave. And if you have used microwave, you know that microwaves penetrate. So that's why terahertz waves can penetrate within your body, into your body. That is the reason. So I won't want to say, like some people I noted have said, that terahertz is so unique, it can penetrate the body. Nothing else can. No, not true. Other ways also can. Microwaves also can. Because if it's the only one, then maybe I'm telling a story. But because other rays also can do it, I'm not telling a story. It's a scientific fact. See? So, these are the properties of terahertz waves that make it very effective in medical treatment. It is low energy, so it does not damage the chemicals inside your body. It can penetrate through materials. So if I switch on the terahertz waves, and if I have a meter to detect it, even with the door closed, I can detect it because it can go through anything that is non-conductor. Conversely, if there is water, it cannot penetrate because water can conduct electricity. Okay? So the energy is very weak. It corresponds to something called hydrogen bonds or van der Waals forces. And people who use alkaline water or this terahertz water, what you break up are the van der Waals forces. So people don't normally study this until you go into physical chemistry and the properties of water and a lot of other things. Viscosity depends on van der Waals forces also. Different biological tissues absorb terahertz waves differently. And because of that, you can distinguish. For example, bone, for instance. Using terahertz waves, you can detect different layers in the bone. In fact, in a way much better than X-rays. And then with some other tissues, to which is opaque, that is, they are conductors of electricity, you shine terahertz waves on it, it is like a mirror, it reflects. So this phenomena is called Rayleigh scattering. So these are the characteristics of terahertz waves. And I am talking about the medical aspects of terahertz waves. Don't ask me about 6G. Don't ask me about the engineering. In medical science, we use it for diagnosis. Radiologists and all that are very interested in terahertz waves for this reason. That is also used for therapeutics. And that's where my focus is on. Basically, I am a medical doctor, and that's what we're concerned in. We use our knowledge to help people. So, the one very important property of terahertz waves, as far as medical science is concerned, is that it resonates at the same frequency as normal cells. This is a very unique thing. Our cells unite at a very, very low frequency, and that is the frequency of THz waves. So all the benefits of THz waves come from this property. And then of course all the other properties that arises from this as a result of this resonant frequency, which is similar or identical to what your cells are doing. So today I will cover, as I said, the central nervous system, and I'll show you this slide again. You notice that among the causes of that, cancer supposed to be the highest, but if you add up all the cerebral vascular conditions like ischemic heart, hypertensive heart disease and all that, it actually becomes the top. Well, we're talking, one of the diseases that I'll focus on is cerebral vascular diseases or strokes. We call them cerebral vascular accidents. That means they happen suddenly and it's an accident. Something happened. Note that it's only 6%. But cerebral vascular diseases give rise to complications. And where's pneumonia? Pneumonia, 18.5%, hides a lot of diseases. Dementias, strokes, and other diseases. If they are bedridden, they tend to get pneumonia, and they tend to die of pneumonia. That is a fact of life. So, because of that, the ultimate cause of death does not quite reflect the underlying disease sometimes, especially if it's a chronic disease. So that we need to understand. So in the nervous system, there are many kinds of diseases, but there are 4 main categories: cerebral vascular accidents, which is strokes; dementias, which again I think all of us know about; degenerative diseases such as multiple sclerosis, ALS, which is a motor neuron disease. Okay, they are not so common in this part of the world. They do happen. I have seen isolated cases of such conditions, but you rarely see them so common. So I will not touch them. Then there are cancers. You heard of people with brain cancers or nerve cancer. My own niece has a cancer of the spinal cord nerve, which grew into such a big lump that has to be removed 2 or 3 times because it recurs. But again, this is not common, and I shall not talk about them. Let's talk about strokes. How many kinds of strokes do you know? There are many kinds of strokes. But we're going to talk about hemorrhagic strokes, ischemic strokes, and transient ischemic attacks. I'll explain to you, and then you will understand. Hemorrhagic strokes. Hemorrhagic strokes, like the name suggests, is due to bleeding. Okay? And of course, blood is inside your arteries and veins, so it has to bleed from blood vessels. And it depends on where it bleeds. Okay? It can bleed in between membranes and coverings. You know, your brain is covered by at least 3 layers of membranes. Okay? Or you can bleed from a burst aneurysm. I show you an aneurysm. I'll show you again what an aneurysm looks like. And you can bleed from excessive blood pressure. That's why it's important to control your blood pressure. Because if not, it will burst. I once was having a flu, so I take some herbs, and being a kiasu man, I take more than usual. So it weakens the blood vessel of my body, and my blood pressure, maybe because of stress, it goes up, so it bursts. Fortunately for me, it didn't burst in the brain or in the heart. It burst inside my nose. The blood was shooting out. So my colleague, the ENT surgeon, put something there to cause the blood vessel to shrink and close up and stop the bleed. That was frightening. If it occurred elsewhere, I may not be here. Thank God. Obviously, God has a purpose for me to do, and that's why I'm here. So it's a bleed.
You were in a hospital when you had the stroke?
I was working inside a hospital.
And you had a stroke now.
So I just go to the ENT surgeon and knock on his door and say, please help me. And they saw me bleeding, they quickly attend to me.
You're lucky, huh? In the hospital.
Yeah, yeah. I was very lucky.
Mm.
I was more than lucky. So this is what the aneurysm looks like. It's like a balloon, okay? And if it bleeds, that's what happens, okay? And another place where it bleeds is between the layers. You see the different layers there? The dura mater, inner outer layer, the arachnoid mater, and all that, okay? Different layers. So why did it bleed in between layers? Anybody knows? Very common accidents. Skull fracture. Okay? Any fracture of your skull, bleed will be in between the membranes of the brain. And this is what it looks like. I want you to take a look very carefully. If I have a, is it a pointer? No. So now this is a very big clot. Huh? How do we know it's a very big clot?
Is there a pointer of your, or the one that you're holding? The one that you're holding?
Oh, okay. Thank you. How do I know this is a very big clot? You look at the midline. Do you see a midline? No. You see the midline have shifted, right? This is supposed to be the center. It's pushed to this side, away. So we know that the clot is very big enough to cause the brain tissue to be squashed. And as a result of it, the brain tissue can die. Okay? Another location where the bleed occurs is what is known as the middle cerebral artery. The middle cerebral artery is important because it is a major artery that supplies the front of your brain. Notice the sharp bend of the middle cerebral artery. If a road has a sharp bend, that's a place where accidents occur, right? And not only is it a sharp bend, note that the diameter is so huge and it becomes very thin as it comes here.
Narrow.
There is a narrowing. So the road instead of very broad narrows, and when it narrows, you know accident can happen. So not only is there a sharp bend, but there's a narrowing. And that's why a lot of strokes occur here. A lot of bleeding occurs here. You see?
From your computer, eh?
Yeah, that one. You gotta use the other.
From your computer. From your computer.
Tick now.
You
Oh,
X from the
Yeah,
computer.
you gotta use your.
thank you.
Yeah, that's
No
what it
worries.
is.
So that's hemorrhagic strokes, strokes caused by bleeding. Then the other kind of stroke is ischemic stroke, caused by blood clots or cholesterol plaques. This cholesterol plaques is the same as the plaques that cause your heart attacks. Okay? So your atherosclerosis, due to this,
I didn't know.
your blood vessels being growing all these plaques to narrow. So this is a normal carotid artery is artery on the side of the head. You can feel the pulse if you press in the right direction. So normally it's like that, okay? So when there are plaques in the carotid artery, it's narrowed, okay? And if it's blocked, it can cause a stroke that's quite massive. Because if it blocks the artery, what happens? That means no oxygen passes through, right? When no oxygen passes through, your brain cells will die. When your brain cells die, that's a stroke already. Like your heart, heart attack is the same thing.
Brain dead.
Yeah. So the thing is, the survival is much better because it's due to the lack of oxygen. There is no pressure. There is no mass there that press on the brain tissues. You see. So survival is always better. 1 year survival rate is 60%, whereas hemorrhagic stroke bleeding is only 38%. 5 years is also better. So this is what an ischemic stroke looks like. See. So whether the stroke is by bleeding or by the blockage, by a thrombus or atherosclerotic plaque, numbness and weakness, confusion. trouble speaking, trouble with your eyesight, trouble walking, dizziness, loss of coordination, severe headache. This is very important. These two, numbness, weakness, and headaches. It occurs sometimes for up to a day before you have the actual stroke. And that's why in many daycare centers for the elderly, they put all this notice up, you know, if you have all these things, please take note and seek help. So, these are the warning signs of a stroke. As we get to the age, we get to know them so that we can prevent that if we can. After the stroke, what happens? After the stroke, it depends on which side of the brain is affected. As you know, most of you know that the stroke affects one side of the body, left-sided or right-sided. So, left brain will cause a right-sided stroke, right brain will cause a left-sided stroke. And the reason why it cross-side is because most of the time, the stroke occurs in the upper reaches of the brain. And so the nervous tissue, as it comes down, it crosses the midline. The right brain crosses the midline to this side, and left brain similarly cross the midline. That's why the stroke is always on the opposite side of the body. Now, so the paralysis will be severe if it's a severe stroke. If it's a very mild stroke, it's just weakness. So you find some people with one-sided weakness only, not paralysis. Then it affects, depends on where the stroke occur. You may have problem with thinking, awareness, attention, learning, judgment. Memory is often impaired. Okay. Again, depends on which part of the brain. The bladder, bowel control will be affected. When you have a stroke, there's always a risk of a second stroke, very high. 23% within 3 months or a year. When you have a second stroke, your mortality is very, very high. The chances of you dying is there. What are the complications?
Yeah, other one you think about speech.
Huh?
Speech problem. It's not,
Yeah, speech.
It's not
Paralysis.
Or paralysis.
When you're paralyzed, you can't speak. Especially when it hits the nerves that innervate the face, you can't speak. You see. And if it hits the midbrain where the basal ganglia is the center of the brain, that is where your Parkinson's control is. It becomes very stiff. So you can't speak is a weakness. So after stroke, whether there are complications or not is an indication of how good the rehabilitation is. Why I say that? Because strokes cause your tissues to die, right? So your muscles no longer is controlled by nerves. So if they're not controlled by nerves, what happens? The muscles start to contract. So you can end up with contractures, tight joint and muscles. And your muscles become very spastic. See? So you can have deep vein thrombosis because your muscles are not moving, your blood flow is not there, so your blood becomes like traffic jam like that, and they clot. And when they clot, they throw up more clots that can go any part of the body and cause another thrombosis, another blockade. That is the reason. And of course, if you lie down and don't turn, you get pressure sores and infections, you can get fits. And because of the contracture, you get dislocation of joints, not fully, but partial dislocation. You can have headaches, you can have depression and insomnia. And if you notice, a lot of the testimonials is what strokes, what THz wave can help strokes is in the complications. That tells you one thing, the rehabilitation is not good. But nevertheless, at least we have the THz blower to help with the complications. Otherwise it could be worse. So with this, my experience with the THz was that insomnia, the contractions, the tightness of the joint and muscle can be relieved by it, as well as the headaches. You see? So, these are the post-stroke complications. But recovery of strokes can be complete. 10% of strokes complete recovery. I think we know of one user who had a hemorrhagic stroke and recovered completely, isn't it? So it is possible, and 10% do completely recover, 25% minor impairment, 40% moderate impairment. Rapid recovery is usually in the beginning, first 3 to 4 months. It can persist up to 2 years. Beyond 5 years, it depends on the severity and on the quality of rehabilitation. So mild to moderate can make a recovery. Recovery after 5 years depends on quality, rehabilitation, and the equipment. So you got to mobilize frequently, you got to exercise, you got to do all the right things to recover. We all don't know who will have a stroke. Any of us could have a stroke. You could be perfectly normal, but your artery, like in your heart, your brain may be narrow somewhere, and all you need is for something to happen, for something to dislodge and block there, you have a stroke already. So that's recovery from stroke. It's like, so the good news is you can recover, but the bad news is you got to work very hard. And the better news is you can prevent it. Try to prevent it if you can. Risk factors for stroke. High blood pressure is a risk for a lot of things, isn't it? Including kidney disease, heart disease, and so forth. If you have, for people with heart disease, with or without diabetes, be very careful. Chances of a stroke is very high. Smoking. Birth control pills, so there are no females here, but if people who take birth control pills, oral contraceptives, that is a risk factor. And that's why we don't give contraceptive pills postmenopausal, because postmenopausal there is a case for giving them hormonal therapy to maintain their youthfulness. And one reason why we don't advocate it so strongly is because of the risk of strokes. Okay. So if you have a history of ischemic attack, that means mild, very mild stroke, you will come again. If your blood is very thick, if your cholesterol is very high, these are all risks for stroke. The more important ones are the first three, which most of us are susceptible. How do you prevent stroke? Good nutrition, healthy weight, don't be overweight, don't be obese, get regular physical activity and exercise. If you're smoking, stop smoking. There is no virtue to smoking, absolutely none. The first cigarette you take, you are at risk for a lung disease already. Smoking, there is nothing to recommend it. Alcohol, there is something. Small amount of alcohol has some benefit. 2 units, in science, 2 units is equivalent to 1 big bottle of beer, or 2 glasses of wine, or equivalent. So limit yourself to that. And sometimes for people who really love to drink, we double it. Okay, 4 units, that's enough. But beyond that, you have strokes. Check your cholesterol, regulate your cholesterol. Your blood pressure must be controlled. And above all else, I think if you use the THz blower, you can improve on some of this. Open up your blood vessels, improve your cholesterol, and things will be better. That's how you can prevent strokes. Transient ischemic attack. The most important thing about this condition is that it lasts only for a few minutes to 24 hours. So you can miss it, but it always comes back. So not unusual to have somebody complain of such attacks a few times. The important thing is, it's basically a stroke. it's basically a stroke, you know. So the risk of an actual stroke, with all the risk, is there. When you are anything past 40, be very careful about this. You know, if you're unlucky, one TIA we call it, can land you with a second actual stroke. If you are lucky, you can have a few TIAs, and if you have a few TIAs, consider yourself lucky. Quickly get yourself treated, and make sure that you prevent an actual stroke. This is for real. This is really serious. We talk about lacunar strokes because in the last few years I hear a lot of people, including a few friends, who have lacunar strokes. Lacunar strokes are mini strokes, they call it. On the MRI, 3 to 20. I got a mini stroke soon after my inoculation. I couldn't balance myself. So they sent me to hospital and they do an MRI. It's a 3 mm stroke on my thalamus. That's why I couldn't balance myself. I get up, I start falling on my left side. So again, this is due to a plaque or atherosclerosis plaque. You see? Now I have went through 3 stent operations. Now when you do a stent operation, you dislodge a lot of minor bits of plaques. So this has gone into my brain. When they do the MRI, they see dots and dots and dots and dots, old infarcts, very small. So this was due to the stenting that was done. The pieces of plaque tissue broken off and then blocked small arteries all over the brain. Okay. But when I have the lacunar stroke, was slightly bigger than that, 3 mm. So you can imagine the others was how tiny, like dots like that. So the location of the lacunar stroke is very important. Sometimes there are no symptoms. You can hit a place where the nerves do not actually may not be non-essential as far as your sensory or your motor is concerned. It could be one of the connecting nerves. So you may not have any symptoms, or you may have symptoms to do with your movements. Occasionally, because the sensory tracts are huge tracts of nerves, it hit the sensory tracts. And as I said, I've come across people recently having sensory strokes. The loss of smell may be gone, the loss of touch in certain areas may be gone. For me, it was a loss of balance. Okay? So it can involve one or more senses. There's always the risk of another stroke. So it's important to take note of the risk factors and to do something about it so that the strokes didn't recur. So much about strokes. Let's talk about dementia. Anybody below 50 here? All above 50? All at risk? There are many types of dementia. The commonest type of dementia, Alzheimer's, senile. Another type is vascular, due to high blood pressure. If you have you see, high blood pressure causes a lot of problems. Every good reason why your blood pressure must be controlled. Your kidneys can be damaged, your eyes can be damaged, your heart, your lungs, and now your brain. You know? So then there's another type of dementia called frontotemporal. Affects temporal lobe is the side of your brain which controls your sensation. So you have a stroke there, you cannot have good sensory ability. Frontal lobe has to do with your personality. So it can occur there. So a person with personality changes and sensory issues, he could be having a frontotemporal dementia. Alcohol related. Substance, alcohol, that's why you limit your alcohol intake. Too much alcohol, you can get dementia. Many years back, I was seeing somebody who was the CEO of one of our oil companies in Indonesia. So when he was brought in, he was hospitalized for confusion. When his confusion subsides and we do tests, we found his brain has shrunk in size. IQ test indicated he was functioning more than 10 years below his actual age. He has lost his ability to think and to reason clearly. His mental abilities have been affected. So that's alcohol-related dementia.
Is it something to do with intoxication or?
It's that alcohol destroys the brain tissue. It's like drug addicts. Most drugs of addiction do that to your brain, like alcohol. Down syndrome, this is a chromosomal abnormality. So because of that abnormality, you can get dementia. I saw a very interesting article of scientists playing with our chromosomes. They try and hook up some chromosomes together and form new chromosomes. When that happens, sometimes you get this kind of thing. You get this kind of dementia-like things. Then there's a dementia, disease associated with dementia. That means certain diseases can cause dementia. HIV is one of them. Perhaps COVID-19 is one of them. Syphilis, a sexually transmitted disease, is another. So infections can give rise to dementia. And trauma, of course. People who box, people who play those kind of games where their head are repeatedly knocked, they can get dementia. Chronic traumatic encephalopathy, we call it. Many talks back, I showed this slide. The effects of THz on the nervous system. 2017 US study, dementia show improvement in memory. 2019 study, Tokyo, we showed that amyloid protein broken down by THz radiation. I will explain what amyloid protein is. Stroke patients show increased blood flow, regain consciousness, and symptoms improve. That is the benefit of using THz waves. So, these are several diagrams here. Amyloid plaque in blue, neurofibrillary tau tangle or neurofibrillary tangle or NFT, not non-fungible token. But this tangle, these are toxic tau fragment. Okay. So tau fragments are inside the cell. Okay. The tau protein has this function. The tubules in your brain that cause your unwanted substance to be removed from the nerve cell. Due to some change or due to some weakness in the membrane of these tubules, this tau protein got kind of dislodged from there, and when they got dislodged, these tau proteins become toxic and they get tangled up into NFT. These are inside the cell, and it is so toxic that this NFT cause this amyloid protein or amyloid plaques, and the accumulation of these amyloid plaques cause cells to die, and is believed to be a major cause of dementia. You see? So this has been identified over the years as the major cause of why people have dementia. So a lot of research has been gone into how we can get rid of this. One of the breakthroughs in recent years has been the discovery of a chemical that when introduced into the brain can cause microglia cells. These are scavenger cells in the nervous system. So you take up the tau fragments and keep it there. Of course, in this instance, it releases cytokines, which is again not good, cause more inflammation. So this chemical allows attach themselves to the amyloid protein and cause microglia cells to eat it up, and so remove them. THz iTeraCare, as you see just now, has this ability to kind of cause these amyloplaques to be absorbed somehow, maybe through the same mechanism. You see, maybe by breaking up the amyloid protein. I wish somebody would do some basic science research to prove how it does that. It would be very, very interesting. So essentially, that's what happens in dementia. That's what happens inside the brain. See? But there's something called mild cognitive impairment. This is normal aging. Huh? Any of you have this experience of losing things? Forget where you place your car keys or place your wallet? I think all of us have. Huh? Can't find the right words, can't find the name of the person you just met.
Let alone my glasses on my face and I'm looking for it.
Sure, not the only one. A lot of people do that. But the important thing is you're able to care for yourself. You attend to your own needs and be involved in normal social activities. See? So mild cognitive impairment is normal. And so this is a reflection. Normal aging, you make a bad decision once in a while. Alzheimer's, make poor decisions all the time. If you miss a payment once in a while, that's fine. But you have problems taking care of your monthly bills, then you have a problem. You forget the day and year of the day and you remember your spouse birthday, that's quite okay. But if you keep losing track of all these things, then it's Alzheimer's. You forget what word to use, that's okay. But if you can't hold a proper conversation, that's trouble. You lose things once in a while, but you misplace things often and you can never find them. That is problem. So, if you have mild cognitive impairment, please take care, because it can progress further. But if you take care of yourself, and if you maintain your mind active, you can avoid a lot of such things. So what is the feature of dementia? How can you tell a person has dementia? Memory loss is the most important thing. Memory loss. You know. Poor judgment and confusion. They have difficulty speaking, understanding and expressing thoughts. What they say and what they do may be incongruent. They have difficulty with reading and writing. They can't even read a complete sentence for that matter, you know. And they wander and get lost in familiar neighborhood, right? So, this is what happens when you have dementia, you know? And you have trouble handling money responsibly. One of my patients with dementia was handing out dollar bills to people. Unfortunately, I wasn't around. But guess what? This is what happened. They repeatedly question, what's your name, what's your name, what's your name? Not once, but maybe 10 times. So that's Alzheimer's. So another thing about Alzheimer's is they become what they call confabulated. They use unusual words to refer to familiar objects. Huh? They take longer to complete normal daily tasks. And usually these are the symptoms that you see first. Huh? Losing interest in normal daily activity. They can be hallucinating. I remember an elderly lady keep getting awake in the night and going to the window and screaming, "Thief, thief, thief, please come and catch the thief." Well, impulsive, not caring. And then sometimes it affects the way your body is, you lose a balance and problems with movement. So dementia is multifaceted, mostly to do with the way you function. Risk factors: lack of exercise, increased risk, lack of exercise. Trump believed that you have your heart for this period of time. The more you exercise, the more of it you consume. So you have less of it. It's actually the reverse. The more you exercise, the more you have. Heart disease and diabetes is a risk factor for dementia. Depression is, smoking and air pollution is, head injury is. You know the various causes of dementia? These are the causes. You see? How do you reduce your risk? A healthy, balanced diet. Very important. Avoid overweight and obesity. Exercise regularly. Keep alcohol within limits. Stop smoking immediately. And blood pressure. Blood pressure is critical. It's been called a silent killer, and it is. If it doesn't kill you, it makes you demented.
How about playing puzzle, crossword puzzle?
Oh, we come to that.
Oh, okay.
B vitamins. This is Alzheimer's organization recommendation recently on their website on health supplementation recommendation. B vitamins is very important to protect you from dementia.
B complex.
Yeah, B complex. Multivitamin pills. Okay. Vitamin D and E are quite important. D is not the entire D. I think it's D2 or D3. D3 and E. And again, E has a whole spectrum. Certain vitamin E selectively will protect you against Alzheimer's. And it's not omega 3, 369. I only know of one preparation that have omega 369 in their order. You know what's omega 9? If I tell you that, oh yeah, of course, omega 9 is olive oil.
Oh.
Oh, there you are, I told you. Curcumin is said to have been effective. So nowadays you find a lot of people coming up with very pure preparation of curcumin. Curcumin has the effect of blood thinners, and blood thinners has the effect of supporting our brain against dementia. So is that something there? I don't know. It is. It may be. I myself is on blood thinners because of my heart disease. So there you are. These herbs I do not quite know. But according to Alzheimer's organization, these herbs help. Okay, let's move on. American Academy of Neurology recently report on this study which has been done. They look at several thousands of individuals, a lot, and they look at their activities, the way they do their chores, the visits to family, friends, and their exercise. So those that they exercise have a 35% lower risk. Those who do household chores, 21% lower risk. Those who visit families and friends have 15% lower risk. If you use your brain actively, not only exercise, household chores, you got a problem solved, right? Household chores require the use of your brain. If you wash your dish, you will wash it in a proper manner. If you sweep the floor, you will make sure that you sweep correctly. You don't sweep this and leave a chunk not swept, and then you use your brain. Social interaction. You see, we know that social interaction is terribly important. It's not how many good and intimate friends you have, it is also the number of people you meet. I used to, this American psychiatrist who's also interested in social psychiatry like me. He was looking at research where how many people you come into contact every day. You can just be a hi bye. I can meet you and I'm on a hi. I can meet you outside and say hi. The more people I say hi to, the better it is. That's a remarkable thing. So, when you compare the rate of incidence with people who exercise and don't exercise, when you compare those who do household chores and all that, those social visits, be engaged, be involved. Don't sit there, do nothing and rot. That's the surest way to get dementia. You don't use your brain, you lose it. How about games? I think there is increasing evidence that a lot of times things to do with the brain, including depression, dementia and all that, that recovery takes place when new nerves are regenerated. Okay? Exercise has this effect. Engaging in social interaction has this effect. And engaging in mental activity has this effect.
Playing chess, huh?
Playing chess, yes. Why playing chess, yes? Because chess is a game of strategy. It requires you to think. So you move the pawn to K4 or Q4. Now what am I going to do? I'm going to decide what I want to do. Do I want to reply, or do I want to attack by moving my knight or my bishop or whatever? Isn't it? Or do I move my other pawns forward so that my castle can be within range of moving forward? So there are different strategies involved. So yes, it will. So mahjong also involves strategy, and in that sense mahjong does to some extent. You can also play mahjong. If you are just doing the same old thing, like that doesn't involve activating your nerve cells, then it will not. Not so much.
Playing down is
Playing down may not. Right? If you have to negotiate a maze, so you're going to try this, oh this doesn't work, I will try. You're going to figure out a strategy involved, yes it will. So the thing is, don't go for one particular game. Involve in a variety of games to make your life fun, so that you protect yourself at the same time make your life worthwhile. That's what it's all about.
How about watching football? Rugby and so forth?
Too passive.
You strategize or you give as a coach.
Too passive.
Telling the coach what to do.
Too passive, and it raises your blood pressure while you're doing nothing. So that's the risk. Now, because exercise is so terribly important, I thought at this talk it will be appropriate to talk about exercise. Okay, when we talk about exercise, people say, "Oh, go and run, go and jog or walk." There is only one type of exercise. There are many types of exercise. In the exercise literature, they recognize the first four. The last one inserted by me because in my work with people, I discovered that a lot of people use exercise for losing weight. So I put it there just to make it complete. But otherwise, exercise, there are 4 different types of exercise. I want you to know. And if you're not doing all the 4, you're not exercising enough. And the younger you are, relatively, the more you should engage in all this. Endurance exercise is aerobic exercise. It makes you strong. It makes you fit. It keeps you healthy. You see? It increases your heart rate, your circulatory system, everything. And it's one of the exercise most people use for weight control. So, by all means go for your jog. By all means go for your walk. There are many types of aerobic exercise. Brisk walking is the best. Brisk walking for at least 30 to 40 minutes is the best. Jogging gives you better cardiovascular benefits. So among my medical classmates in the chat group, they were debating on what kind of exercise, and some come up with this brilliant idea. You jog for a certain amount of time, let's say 5-10 minutes, and then walk for that length of time. Intermittently, yes.
Why is brisk walking the best?
Because jogging affects your joints. The damage on your joints is much more. Brisk walking, no. Brisk walking, you are exercising a muscle. This kind of walking, gere as they call it, your bones are hitting one another. Your muscles are not engaged. That's why it's not good. Brisk walking does. That's the difference. And that's why you want to engage your muscles and your joints together to have that effect. So dancing, swimming, cycling are all. And if you dance good, it's an activity that gives you a lot of pleasure, connect you with people, and give you the cardiovascular benefits. Climbing stairs, hiking up a hill, physically demanding chores like mowing the grass and all that, playing tennis, basketball, and if you're above 45 or definitely above 50, you need an exercise prescription if you have never exercised before. I assume all of you exercise? Huh? So I can rush through the next few slides. Huh? So Singapore, the good news, Singapore, a lot of us are exercising. 80% of adults exercise. That's good news, isn't it? We don't know how much exercise. That's the thing. Because we've been in the US, only half of the adults exercise. For comparison.
They watch football too much.
Huh?
They watch football.
Yeah, they're very sedentary.
Potato court.
You exercise, target heart rate 62 to 80. What's the target heart rate? It is 220 minus your age. The older your age is, your target heart rate becomes lower. But if you're at my age 70, 220 minus 70 is about 150, isn't it? And I reach 150 very fast. But because I've been exercising all along, since I turned 40, I can still hit 150 and I don't get any bad consequences. But if you have not, you've got to be very careful. So normally we try to go within this range, 60 to 80% of this. Aerobic exercise, 20 minutes is enough. 3 to 4 times a week, do it alternate days. If you do it for weight loss, you got to exceed 20 minutes. The best way to exercise, join an exercise group. I discovered there are plenty of exercise groups on Singapore. Everybody, if hey, you want to join us for jogging or cycling or walking or whatever, they form this group and they do it together. That's part of the fun of living. Do things together and keep healthy.
Motivational.
Strength exercise. This is weight training. I go to a gym to do this. Resistance exercise, you must have resistance. What's the purpose of weight training? Increase your muscle bulk. Your muscle loss increase with age. If you're more than 40, you will have lost muscle bulk anyway. And one of the ways to tell, ask a person lift his hand, and you can see the butterfly flag there.
Chicken
The
wings.
butterfly flag is an indication of muscle loss.
Mm.
Okay? If you do weight training like myself, there is no flag. It's firm. It's all muscular. It's important as you get older because you know why people fell and they couldn't get up? Because they don't have the strength. The muscles of the legs are weak. And when the muscle of the legs are weak and the muscle of the hands are weak, to get up, what must you do? If there is a support, you hold on the support. If there is no support, you leverage on your hand to push yourself up, right? Then you use your lower limb to get up, isn't it? If you can get up, that means both your hands and your legs are very weak. So you use weights at home, or nowadays gyms are so cheap in Singapore. Join a gym, do the weights, and if you don't know how to do so, get a proper coach to teach you how to do that. Because it's terribly important, because muscles burn off calories due to the muscle tone. And that's how you keep fit. You don't have to diet. You just burn off the calories so naturally. balance exercise, now this is terribly important. Balance exercise prevents fall. As you get older, you fall more often, isn't it? And when you fall often, you get injuries more often, fractures more often, right? You get out from the seat, you can lose your balance. Sudden movement, you can lose your balance. So Tai Chi is very good for that. Because Tai Chi, you really got to keep balance. And a good test is heel to toe walk or standing on one foot. Can you still do that? It is a good way to get this balance exercise. And the next one, flexibility, is to engage in a game like tennis. Because the sudden movement to respond, you get back the balance, you see. But if you haven't started and you want to start, get somebody professional to help you to get started, and then do something enjoyable so that you get the exercise as well. Now these are all the balance exercise. If you cannot play a game, if you cannot do the things by yourself, especially after stroke, these are the kind of exercise that help you to balance. You see? Okay? Flexibility exercise. This is also important. If you are able to stretch yourself, you have this freedom of movement. How many have difficulty tying your shoelace? That is a measure of how you can stretch. See, off and on I got the tightness on my left side, and with the THz, I can relieve the tightness. But that's what happens as you get older. So you need to stretch. And usually combined with strength exercises. So if you live an active lifestyle with aerobic training and whatever games and so forth, you get a all-rounded exercise that you need. These are the kind of flexibility exercise that we talk about. Stretch. And if you go to a gym and you do the weight training, you find that they recommend that you do stretching before and after. That's what is needed. Weight control. Aerobic exercises are used by most people who want to lose weight. But if you really want to lose weight, you combine aerobic with strength exercise. As I explained to you earlier on, strength exercises give you the muscle bulk that enable you to burn calories even when you are not exercising. You see? So when you combine a proper diet, you don't have to starve yourself just to lose weight. You lose weight by maintaining a certain lifestyle. Over-exercise can lead to weight gain. True or false?
In a way, yeah. Gain not fat, but gain weight. Muscle is heavier than fat, yes. Over-exercise can...
It can also lead to overeating. If you are too anxious, you can cause inflammation, and it does cause overeating. But generally, by and large, when you exercise, it leads to a reduced appetite. Even though you feel like eating, you don't eat as much. But when you get anxious over your exercise, it becomes a psychological issue. And that's when you gain weight. So what are the benefits of exercise? Now, I already gave the cat away just now. In response to a question, I say exercise causes you to increase your brain cells by causing nerve cells to regenerate. That's how you improve memory and brain function. It protects against chronic diseases, all the chronic diseases. When I talked about obesity some time back, I said obesity is a risk for all diseases that are not of an infectious kind. And exercise protects against all these diseases other than infection. So you see the opposing effects of exercise and obesity. It aids in everything, weight management and so forth. Lowers your blood pressure, improve your quality of your sleep, decrease feelings of anxiety, depression, and so forth. Most important thing is you want to live a long life. No point living a long life if for the next 10 years of it you are in a hospital on a respirator, isn't it? No fun lah. I don't think I want to do that. But if you have 10 years of fun, you see, exercise not only improve and protect you against diseases, but like I said just now, we cannot prevent ourselves from getting a stroke. When you exercise, the incidence of stroke in your life get further and further. That means you get a stroke later and later. So let's say by your family history, you should get a stroke by 60. You may be able to extend it until 70. And not only you extend your life free from stroke, but when you have a stroke, you are more likely to get a mild stroke. That is the effect of exercise. So a phrase that we use is, not only do you put years into your life, but you put more years into your life. You lengthen the years in your life and put more years into your life. Your life becomes much more fun because you exercise. And if you exercise in groups with your friends, as we shown in the earlier slide, not only you have the health benefits, you have the benefits of connecting with people. And now you have the benefit of iTeraCare, which improves on so many functions. And don't wait until you have a stroke to use iTeraCare. Use it to prevent. That is the message I want to give you. So, the quality of iTeraCare waves, which it shares with microwave, is that it can penetrate. So it doesn't matter whether it's your nervous system or whether it's dementia, because it can penetrate up to 20-30 cm, it can impact you positively. That's why we want to use iTeraCare. It improves the circulation. A lot of problems that we talk about, all the diseases today, all the nervous diseases we talk about, has to do with impaired circulation. It can affect all these things. And iTeraCare way is down your pathway for you to improve on that. And of course, it activates inner cells for recovery, for prevention, whatever. Normal cells will increase in temperature and normal cells will be activated. So, if you want to prevent all the bad things happening to you, increase self-healing. When you exercise, you know what happens? You are damaging your muscle cells. That is a fact. I'm telling you. Why you want to damage your muscle cell? Because when your muscle cells get damaged, it attracts all the stem cells into your muscle. And that's why your muscle grows bulk. Because you exercise. See, the body has a way to repair itself, isn't it? And that's how it does. iTeraCare wave actually helps the normal human function of repair and regeneration. That's what I want to tell you. See? It's a very powerful tool. So, an ounce of prevention is worth a pound of cure. Please prevent. Use anything available. If you have a family history of weakness for a particular disease, take the appropriate supplements, use THz waves, exercise, keep your blood pressure, your cholesterol low. And anything to do with inflammation, joint pains, all sorts of aches and pains, blockages, skin, THz wave is very, very powerful. You know. And the only thing it should be used are things like this. Acute diseases don't. It may not work that fast. We cannot predict what the response will be. Congenital condition, we have to be careful. Some can, some cannot. Object implants, because you will absorb the THz waves, it may build up some resistance. Open wounds and fractures, no. Apart from this, there are a lot of things that you can use it for. And if you look at the testimonies on YouTube, most of them has to do with chronic illnesses, which takes time, which depends on your lifestyle. And in that sense, this is agreeable with whatever health objectives we may have.
May I ask a question on that?
Yes.
Is it generally a contraindication when someone has some metal in their neck or
What?
metal, and like had an operation and the doctors had to insert the metal to?
Can I answer that later on?
Yeah.
Huh?
Thank you.
Okay, so this is the bioresonance scan which I use to detect whether you have any organs that are weak and needs attention to. Okay, so if you have a THz blower and you don't know where to blow and you don't know which area to concentrate on, you can do a bioresonance scan, see which part of the body is weak and which you need to pay attention to. Okay, so these bioresonance scans I do for people. So this scan, I give you a 50 discount on what is normally 200, so you pay only half that. I also offer courses and coaching program on things like stress, mindfulness and resilience, transforming trauma, living a life of abundance. And depending on how much you want to pay, you get the appropriate services. And of course, books I've written are on the table, so you're welcome to it. Okay, now I will answer your questions. So your question?
Yeah, beg your pardon for butting in. So sorry.
Yeah, what was the question again?
The contraindication, is it generally?
Okay,
generally
if there
when
is an
someone has-
implant, okay, it depends on what kind of implant. For example, they say that if you have intraocular implant, you should not, or stents, you should not. But my understanding is, it's been more than 10 years that all the stents can be absorbed. So Lee Kuan Yew, when he first had his stent, it was non-absorbable. It stayed there forever. But my stents certainly are absorbable. It cannot be seen anymore. I know because I did, what do you call that, the treadmill, with the catheter inside, and you can see the entire blood vessel. There were no scans inside. So intraarticular scans are now generally safe. They are inert material. But how about metallic, what do you call it, titanium implants, which many people have, including my wife, who have went for bilateral knee surgery. If you really have to use it, this is not the official policy. This will be edited from my talk. This is not the official policy. Use it very cautiously. Use it very cautiously. And if there's no benefits, stop. If there are another way, maybe you should try the other way. But I recognize that sometimes you're left to your devices. And in clinical medicine, sometimes it's like that, right? When my father had stomach cancer, he tried everything. The doctor said, we can only help so much. So what did he do? He go to a Chinese physician, he got a lot of herbs. cancer of the stomach usually lasts 6 months, the most 1 year. Thank God he lasts 4 years. You see? You use care cautiously. Maybe you succeed, maybe you don't. Maybe to do something is better than not. When I had this bioresonance scan 8-9 years ago, a lot of the people come to us, they had cancer. They try everything, and the doctors have done everything for them possible. Last resort, they come for the bioresonance scan. And I certainly know of a few who improve. We cannot save all of people, but we save some. So when you are very, very desperate, and this is not the official policy, let's put it very clear. Official policy is you have an implant you can't use. You have a pacemaker, I would say almost no, because pacemaker has a certain pulse, and we don't want to disturb that. But other than that, be very careful.
So correct me if I'm wrong. Yeah, pacemaker, I know you just can't do anything about that. But if someone has implants, titanium,
Yes, that's what I said, be
certain
very
area
careful.
I do on the other parts of the body. So far it's so good, but I don't know, that's why I asked you the question.
Be very careful.
Yeah.
Nobody can promise you.
Mm.
If you have left with no alternative but to try this, what can I say?
Mm-hmm.
I've seen many patients in my life who reach that point. And this is what I tell them.
Yeah.
These are the risks. You know the risk. This is not the official policy. You do it at your own risk.
My most recent, she called me yesterday morning, and she had 3 mini strokes 2 weeks ago, and she had just ordered the premium yesterday, and she wanted me to work on her with the premium that she had bought, which would be delivered I think in about 2 weeks.
Yeah, with the premium you have more options available.
Why is that so?
You can either the heat or the cold version.
Yeah, I like that.
And I think there may be other variation on the premium that I don't know about, you know. But the thing is, in just, I call this borderline instances. And being in the health field where I deal with real patients for a greater part of my career, these are the kind of dilemmas that patients have. I cannot say no, can I? Because they are at the end of it.
Yeah.
There's nothing left for them to do. And they want to try it.
They
I
try
cannot say
everything.
no.